Hello, everybody. Welcome to another episode of Meddkit's Provider Spotlight, where we sit down every week and we get to interview some amazing private practices all across the United States. This is a chance for us to really get to know the people behind the practice, get to know their perspective on healthcare and how they are impacting their community. And today with us, we have a very special guest, Dr. Winston Vaughan, the co-director of California Sinus Centers. Welcome, Dr. Winston.
Thank you. Thanks for having me.
Course. Now, I'm super excited for this. I'm really excited to get to learn about what you do, and we have a lot to get through. So I'm sure a lot of the people that are watching would also love to get to know who you are. So if you want to just start by telling us, what inspired you to open up your own practice?
Yeah. Now, I'm an ear, nose, and throat doctor. So most people know that as ears, nose, and throat, but our specialty is called otorhinolaryngology. Easy way to remember it, just point otorhinolaryngology. And ENT is pretty amazing. We cover several areas of how you live, how you speak, how you eat, how you swallow, smell, taste, hearing. If you think about what ENT is, it's pretty huge. My dad's an ophthalmologist in Jamaica, and he just deals with this, the eyes, while everything else around those areas, ENT doctors deal with. We also even go into the brain now. So if you have a brain problem, a brain infection, a brain tumor, quite often we'll go through the nose, something called skull base surgery, and remove those things through the nose versus coming through the skulls. ENT doctors also work with eye doctors to help with thyroid eye disease or lacrimal tear duct problems. So that's why I became an ENT. We do a lot of cool stuff in the operating room, but we also do amazing things in the office in terms of treating patients. Most ear, nose, and throat doctors spend about 60 to 70% of their time in the office trying to avoid surgeries and do procedures or medical management or diagnostic tools in the office. Became an ENT because my dad was an ophthalmologist, an eye doctor, and I saw what he did for patients, how he enjoyed his daily life from when he got into the office to even when he came home and he spoke to patients, on the ride home. It's a very fulfilling life to be a provider, whether you're a nurse, a hospital administrator, a surgeon, a radiologist, to provide care for people and try to help them have a better life is really an honor. It's a spiritual gift. It's a privilege. And so that combination of surgery, medical management, and being able to work with people and share their lives with them, it's pretty cool.
Yeah. Yeah, of course. That's so true. Like the way I think a lot of people in the healthcare, industry don't get as much credit as they should. And this is partly why we do the provider spotlight to make sure that their message is getting out there and that people are knowing what they're doing and getting just a little bit more education on what they do behind the scenes and the actual stuff. And knowledge that it takes to treat patients. And one thing that piqued my interest that you said was working with like the brain disorders, like the skull-based disorders, because I think a lot of people think that there's a specialty specifically just with brain doctors. A lot of people think of psychology and stuff like that. And so to learn that ENTs also work with the skull is quite fascinating. And I'm sure, in all those years that you've been doing this, you've seen some pretty interesting things like these skull-based disorders. And I would really love to know, and I'm sure the people watching would love to know as well, like what are the most common areas that you treat with patients? And what are more interestingly, some of the most uncommon things that you've helped treat?
Yeah. So, let's talk about the most uncommon things. So, fortunately, cancers or tumors in the ear, nose, and throat are pretty rare. They were much more common in the past related to people who had tobacco or alcohol misuse, abuse problems. Um, Toxic exposures from working in coal mines or around toxic chemicals would induce changes, as you could think, in the ears, nose, and throat, specifically the nose and throat areas, so throat cancers. A lot of those problems, fortunately, are less common now. The most common things we see in the ear, nose, and throat field specifically are related to nasal congestion. Can't breathe through my nose. I've got sinus problems. I've got allergies, difficulty swallowing, heartburn, reflux, earwax, stuck in the ears, difficulty hearing, loss of hearing as you get older. In my subspecialty, which is called rhinology, which is really just the nose itself, the most common things that we see are patients who come in and saying they are just having difficulty breathing. It's affecting their exercise, it's affecting their sleep. They're getting kicked out of bed because they're snoring, or worse than that, they may have sleep apnea. Nasal problems are pretty impactful if you've just gotten a cold and you see for 3 to 5 days how miserable you feel. For patients who have chronic problems, such as what we do mostly in our practice, managing chronic sinusitis patients, those are more than 12 weeks of symptoms. So headaches, postnasal discharge, nasal obstruction, decreased sense of smell, and that can impact somebody's quality of life, leading to depression, sadness, loss of energy, fatigue, just feeling run down. That's what we treat mostly. Our patients who have just had too much of this going on, and they're like, help us. And it starts off very simply. It starts off quite often with just talking to the patient, finding out what's happened, what their living environment is. You've got three under 7-year-old kids at home, and they're all bringing home bugs. Something's gonna happen in your nose, and you're not gonna like it. You
So
pray to
right.
God they grow up fast and you get better. Or construction in the home, allergies, water leaks, black mold, toxic exposures, COVID. COVID was a big impact in the nasal cavity. So very common things, which most of us have every day, presents to an ear, nose, and throat doctor like me. And then very, very rarely are bad things that, we fortunately, as a specialty, have really advanced the therapies for the really bad things to provide excellent outcomes in the field of head and neck cancers with radiation, minimally invasive surgery, stereotactic dissection, where we use computers to dissect around scary things. Um, ENT is pretty cool.
Yeah, that sounds amazing. Like, I think we don't realize just how much around us can affect our eyes, our ears, our nose, and our throat. Of course, we realize, when flu season comes around, we're like, oh, here comes my throat. My throat's going to be scratchy. My nose is going to be running and
Yeah,
leaky. It's,
yeah, yeah,
we don't realize around us, like everything that can affect, what goes on in here.
yeah.
Um, and you mentioned about the computer stuff that you use for the more serious things. I would love to know a little bit more about that because I've never considered ENTs to kind of work with those types of serious, cases and stuff. So if you could tell us a little bit more about that, that'd be great.
Yeah, no, it's one of the reasons why I became a sinus surgeon. So when I did my residency at Stanford, we started to use technologies where the CT scan or MRI that's done on the patient to diagnose the location of their disease would also tell us the location of things that we don't want to injure. And I did my fellowship in Savannah, Georgia, came back to Stanford, and started working in the Greater Bay Area several years ago as a private rhinologist. We now use standardly the images that were done preoperatively to create a GPS-like navigational image, 3D, of the patient's anatomical finding. So as an example, if you have a nasal polyps between your eyes right here that block off this area, and then the upper sinuses above your eyes can't drain down through your nose through here, and your main problem is right here, we're basically operating between your eyes and onto your brain. And this is an area where we love to go, but we tell you that, and you're like, whoa, this is pretty interesting. And so we create these maps that are basically image guided navigational CT scans that can be reviewed before surgery, but during the surgery, while we're using endoscopes through the nose, we have a separate television screen that has the preoperative scans mapping out where the tools are going as you're dissecting. It's not AI. It's not going to be some computer dissecting in your head. It's not a robot.
Mhm.
It's the ENT doctor using their knowledge of the anatomy to dissect in the area where the disease is, but also using the CT scan to show the boundaries of, uh-oh, don't cross this lane, or you're approaching this lane. Do you really want to dissect really fast here, or do you want to slow down? And it allows us to be thorough, accurate, less destructive, for hopefully faster recovery. It's something called image guided sinus surgery. And it's really changed the field, reduced the complications, reduced the need for nasal packing. Quite often, like I'd say 95% of my patients have no nasal packing after their nasal surgeries. So you don't have to go home feeling like, oh my gosh, there's this, things up my nose. So that's how we use computers. There are newer technologies coming to market where you can now um, create a almost like a trajectory, a pathway, so you can guide yourself, and it creates a 3D volume which you move through as you dissect. And those technologies actually not that new. They've been around for several years now. Also, kind of make it more fun for us as surgeons, where you're playing like a video game. But it's not a video game, obviously, it's in somebody's head.
Man, that is fascinating. It's crazy how to see the advancement of technology used in healthcare and what's been able to be done, in treating these patients and to be able to. When you said a video game, I immediately was like, "Oh, this is so cool!" Like, imagine you being in there just going through. That's really cool. It's really fascinating. You were kind of getting into kind of like your approach to these things and how you really use this to take care of your patients and to offer them a more in-depth look into what is going on. And so I would love to know, I would assume a lot of ENTs and sinus doctors have like their own important process or approach to these things. And so I would love to know how else, your approach is different, or if there's certain things that you come across where you're like, okay, we need to switch tactics and we need to do this instead. If you could tell us about.
No, that's a great question. We are a private practice in the greater San Francisco Bay Area with offices in Atherton, San Francisco, Sonoma, Walnut Creek, and Pleasanton. So we cover the greater Bay Area. We're in the middle of Silicon Valley. We're in the middle of AI boom.
Mhm.
And you think it's all technology and robots and Star Trek, and it's going to be unbelievable. You're going to come to us, and it's going to be just all technology. But the number one thing that we do is actually sit down and listen to people. It's the best thing about medicine. I mean, somebody comes in, quite often our patients will come from all over the West Coast. They've seen other doctors, and most likely what they really want is somebody to spend 20, 30 minutes with them, talking about their lives, getting to know what's going on, what went wrong, what went right. Um, and there's usually a ton of fear and anxiety when somebody has something going on between their eyes and under their brain. We're lucky that we have nurse practitioners in our practice, medical assistants, and we're a no rush clinic. We have a philosophy that we want to really spend time getting your information. And so, quite often, the staff will spend a lot of time talking with patients. We use a voice activated dictation system. So, we're not just typing away on the computer while we're talking to you, but we're actually looking at you and interacting with you. We take a lot of information before. And that part of the human interaction versus all the technology, I think is one of the joys of private practice. We can afford to slow down and
Mhm.
spend time with patients. We have a philosophy that we care. We're CARE, capable, caring, compassionate, available, appropriate, we're resilient, responsive, emotional, and experienced. And every single one of our staff members knows that little poster we have in our waiting room. And once we spend that human part of the interaction, um, during that time, you usually find out a lot about people. As an example, if you're going to operate between somebody's eyes and in their nose, If that person's a professional chef, you want to make sure that you preserve their smell and taste. That's super, super important. If you're operating in somebody's throat and interacting with their nasal airway and their oral airway, and they're a broadcaster for CNN, don't want to change their voice too much, right? And you want to know,
Right.
what's important to them. And if you kind of just looked at the images only and you have a surgical plan, and this person is, the Anthony Bourdain, and his voice and his smell and his speech may be affected, something needed to be evaluated. So talking to patients is still the best part of our job for all ENTs. Um, and once we do that well, and we combine that with diagnostic tools, looking in somebody's nose, in my case, we have video goggles that patients put on. So when they come to see us after we talk to them, we do something called endoscopy. That's where we look around in the body. Pretty scary because we're going to put something in your head, but we spray your nose, we give you some gum or candy because the sprays are pretty yucky. And after you've kind of rebalanced your taste from the yucky sprays, we put on video goggles that the patients can actually see inside their body. They're not really virtual reality, so it's not like you're climbing into, um, you know, I think it's Roblox my daughter plays. It's not Roblox, it's you. And we have television screens that family and friends or partners, and sometimes kids and patients also will bring their dogs into the office, can watch the television screen while we look around. And then we look around, and while we're looking around, we'll show you and educate you on your anatomy. Here's your nasal septum, here's the turbinates, here's the nasal polyps, here's the drainage coming out of the back sinus. This is what's draining into your throat. This is why you have postnasal discharge. This is why you're coughing. Let's get a sample of that mucus, send it to the laboratory. And so by the time we're done with endoscopy, which takes about 3 minutes, maybe 5 minutes, patients go, "Oh my God, I didn't know there was so much in there, and now I know why I feel so crappy." And so that's probably a long answer for your question.
No, that was perfect. That it's so educational and insightful because you're so right. There's a lot, especially in a lot of healthcare industries, there's that missing element of connection and humanness and just allowing the patient to tell you what's going on. You go to a doctor's office and they give you a little intake form and they ask you all the basic questions and stuff like that. But rarely, if any, do they sit you down and get to know not necessarily your personal life, but a lot of the details that would matter, especially if you're, undergoing something as serious as like, sinus surgery or going into the brain. You explained you've got these really cool goggles, which I think is fascinating. So cool. You seem to have like all the video game like stuff in your practice. And so it's really important for those details to kind of be in there. And you explain that so well, especially whenever you were talking about, AI, the AI boom and technology. A lot of people will go and use like ChatGPT or Google AI and search up for answers. And there's just that missing element of, man, I wish I had like a sinus doctor in my room to kind of tell me like how why this is happening, late at night whenever they're stuffy and their nose is just like attacking them and stuff. And so speaking of that, it's like all the AI stuff and all the, I guess, misconceptions that are out there online with social media. What could you tell these people who are searching for answers? What could you kind of debunk for them, do you think? What are some of the
Yeah.
misconceptions in your field?
I think more information is very, 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 very good. In the past, we all used to say, "Oh my God, I hope this patient doesn't come in and has Dr. Google as their initial consult." And so the patient walks in and says, "Well, Dr. Google tells me I've got nasal polyps obstructing my right frontal sinus, and that's causing my sense of smell loss." And doctors would be like, "Well, I went to med school, and Dr. Google didn't go to med school, so why are we even talking about this?" I think that's really rude. I think that, most patients are they really want to find out what's going on in their body, and AI, Dr. Google, ChatGPT, everything that's out there now, PubMed, open evidence. This is important. This is their body. This is their and God forbid it's somebody's child or their partner or their kid. This is their most important investment. It's
Mhm.
their when a kid gets sick or your partner gets sick or friend or parent gets sick, that is the most emotional impact. That's not just your car tire being, blown or Yelp review of a restaurant. This is somebody that you really love. And if you dive into the internet and all of its educational tools, you're going to get information. And that information currently, I would say, is 80% accurate. I am not going to argue with patients saying, no, I know better than the data that you have. However, we as physicians, providers, nurse practitioners, PAs, even medical assistants, front desk staff, we've been living the disease with patients day in, day out, seeing 30 to 40 patients per day. And we know the flavors of symptoms. So when you call and you speak with us or you come on in and see us, we know that, yeah, you've got this problem, nasal congestion, but we can figure out what's causing it with you. And the internet search engines may not do that really well because you are you and you are independently you. And so our job is to help you have that box of data, and then we can help you go, oh, it's really your septum. It's not a huge tumor in your head. Oh, it's your turbinates, these sausagey moisturizers in your nose, and they're inflamed because you just got a whole bunch of house plants. I can see them behind you. You have new carpet, and you have a cat that sleeps in bed with you, and we can help you get better without any surgery. Or no, it's pretty bad in there. You had prior surgery. There's lots of scar tissue. Something has grown that's blocking off the cavities. So I love the fact when patients walk in and they say, "Oh my God, I have these 7,000 questions for you." Usually, what I say is, "Time is money. Let's let's get the 10
Right?
let's get the 10 key questions down because I know you want me to answer every one of these questions, but let's get the 10 key questions down. My staff can also answer tons of questions before I even walk into the room. And if we're not done in the allotted time and I have to rush off, and that happens quite often, we see 30 to 40 patients. I'll give the patients my email, my cell phone, or I'll tell them I'm going to call you on my drive home and we can go over the next 622 questions that ChatGPT told you to ask me. Those patients are some of the most grateful people because they don't feel rejected. They feel like we're going to answer their questions. And if we don't do it in one appointment, we can do it, electronically as follow up. Send me the questions. Yes, no answers. I'll say yes, no, yes, no, yes, no.
That's incredible. And what you said, I agree with. I think the use of online tools can be great for educating yourself and getting an idea of maybe what's going on. But then, of course, where you guys come in is that human element of actually knowing the other details. You could put into ChatGPT, oh, I'm feeling this way, what's happening, but you can't really tell it like this is my personal life, this is everything that's going on, what is your diagnosis, things like that. And so it's really important with what you are doing, especially with being able to, answer all of those questions. I'm sure they come in and they're just like, I just need answers to this. I just need help with this. And I've got all these questions and stuff like that. So it's really amazing that you can, you can tell them like, hey, I might have to run, but after this, I will be free to, answer everything that you've got. And it really shows that you have like a patient-centered care approach, which is pretty amazing.
I
Um,
mean, also our staff are really good. I mean, the medical assistants and nurse practitioners that we work with in ENT throughout the whole specialty, quite often, as I said, these are experienced individuals who, even if the physician says, this is your diagnosis, quite often there's a debriefing with the staff member who is left behind, whether it's a medical student, a resident, a nurse practitioner, a PA, there's always, after the physician leaves, there's continued education that can occur. And hopefully our staff members will say, okay, he said these 27 things and you're totally confused. Let me break it down for you. You just need to do your nasal washes, see an allergy physician. You don't have something big and bad grown in your head. We're going to start you on some antibiotics to get the bacteria out. You're going to get some steroids to open up the sinus cavity so they can drain. The mucus that we suction out of your nose is going to the laboratory, and I'm going to call you on Thursday to let you know what's going on. So, those are things that, again, our staff are really, really well at kind of like slowing it down for the patients. Quite often, our patients will record the physicians or record the staff members, and we are never offended by that. So that when they leave the office and their brain is like, I had, it was too much, they can read their notes or they can listen to the recording from the visit and go, okay, these are the things that I need to stop and get on my way home. These are the things that I need to change in my environment when I get home. And these are the information questions that have been answered. And these are the questions that I really don't have to worry about.
That's really cool. I've actually never heard of somebody like a practice allowing people to go in and record like their staff. I think that is fascinating. And honestly, that would have helped me a long time ago if I was going to like doctor's offices and I'm just like, information overload. You've got a lot of questions, but then you also get answers and you're just kind of like, these patients, like they're not as educated as you guys are in this field and they might not know what all these terms mean and stuff like that. And so, allowing them to go in and like say, hey, we trust you to record, that's fine.
Yeah.
And for them to use that as a tool, that's incredible. Do you do that with, do all of your staff members, are they all okay with that? Is that kind of the approach?
Yeah, yeah. I mean, again, it's a two-way street. We are asking patients if we could record their interaction into our scribe system. So we're going to record what you're telling us.
Hmm.
You record what we're telling you, right? You don't want to be like, oh, I can only record and you can't touch the record button on your phone. It also allows misunderstandings to go away. You don't want miscommunication. You don't want misunderstandings. You don't want people to think you said something and you said something else. And if that happens and they listen to a record and they go, wait a minute, did you tell me to just use regular tap water in my nose? And you're like, no, we didn't say that. We wanted you to use distilled water and we wanted you to microwave your tap water, so simple things like that. If there's a misunderstanding or the patient heard, he wants me to do nasal saline irrigations. But when we say nasal saline irrigations, we're not talking about going to the kitchen sink and washing your nose, with your old coffee cup. It's not the same. It's totally different. Um, but I think it is changing for physicians and providers to allow better ways for less miscommunication, better understanding, clearer instructions. And one way to do that, especially for patients who are older, especially if there is a child and two parents come in, or two parents and a nanny or friends, and one person goes, "Oh, he said do this," and the other one's like, "No, he said do this," and then the kid's sitting in the middle going, oh my God, you too. We're both freaked out during the visit. Um, I think he said I'm okay, and I think I just have to do some nasal rinses, and I can do this myself. So recording actually is really useful in my practice, and I would suggest others do it. Older patients also, they they can get lost, and if there's anxiety, stress, dementia, just coming into a physician's office quite often can be super stressful. There's going to be some loss of data, and I prefer somebody to record it, and then to be actually really, really mean about it. Your appointment goes faster if they're not writing. So if they're writing saying, "Well, excuse me, did you say then you're like, oh, stop writing. I got to see my next patient. Well, if it's being recorded, you're like, okay, they got everything.
Hmm.
You got everything? Great. Have a great day.
That's yeah, you're so right. And I think that's great that you're suggesting kind of having this as like a suggestion for other providers to kind of use this strategy because it's excellent for you guys and it's excellent for patients. And kind of on that note, you've given us so much already to think about and some amazing insights and perspectives. Do you have any other tips and strategies that you would give to providers, either in your specialty or just in the healthcare fields? And number two, other tips that you would give specifically for patients that are just wanting answers.
Yeah. Um, I think for providers, um, it's that's a super hard question. Um, because the practice of medicine can be stressful financially, emotionally, but many of us went into medicine because it was our dream. And if you're a provider in medicine, there are thousands of people who didn't get to where you are. So be super grateful for where you're sitting, what you're doing. Going through a pandemic where we as providers were basically stopped seeing our patients. Several people went into financial distress. Several practices um, had to lay off staff members. We went through a war. Healthcare just went through a war. And we're out of that war right now. And the gratitude of surviving that war, just like veterans did, and realizing how blessed we are and what we do, and how privileged we are for people to walk in and say, hey, I got a runny nose, and I've got all this congestion I can't smell and taste, and I've got headaches. And they're being really personal about their body and their lives is it's more than a privilege. It's kind of an honor.
Mm-hmm.
And then from that honor, we still get a great quality of life. Physicians are quite often in the top 10, even sometimes 1% of society in terms of what we do. And we're not doing that by, you know, digging in a coal mine or driving a truck. We're doing that in a comfortable office. So, gratitude, reminding yourself how blessed you are to be a provider, physician, nurse practitioner, PA, even our staff members. I think it will make medicine, especially post pandemic, one that we all look back and go, yeah, we went through hell and we have something that we're doing and we're really enjoying what we're doing. Um, the next thing I would suggest is love your patients. I mean, these are people who are walking into your practice and trusting you. Quite often they've fully vetted you. They've gone online, they've read up on you, their family physicians have referred them, their next door neighbor says, "Oh, this is my ENT. You should go see her." Um, so they know a lot more about you than you think they don't know. And so they're coming in quite often, not just because you're, in network, but because they've shopped around, they've thought about, I want to go see this person and I want this person to help me. And so just like a maitre d' at a restaurant, make them feel super, super welcome because they chose your restaurant to walk into. They chose you as their chef. So that's an honor to start off with already, and you can only screw up the meal or give them the best, dinner experience in your medical restaurant. And then when they leave that, they're going to either Yelp you and say, "Man, that food sucked and the chef was horrible, and the maitre d' was just toxic and she yelled at me for my copay," or they're going to leave you and go, "You know what? Those are good people, and I would have any one of my friends and family eat at that, medical restaurant." It's a great specialty. Medicine, as I said, from, the front desk person to the anesthesiologist to all that we do. It's also the largest growing industry. When you look at the jobs report, guess who is doing good? Healthcare.
Yeah, that's amazing. That's such it's amazing advice, but it's also like underrated advice. You always get these people online saying, "Oh, be grateful, do your gratitude journal and stuff like that." But I mean, to really understand what you guys went through during the pandemic and all of that stuff, and then coming out of that, triumphant and scarred, obviously, but also triumphant with that. It's like that's incredible. And to kind of look back, if physicians can look back and just be like, yeah, we did that. We took care of business during that, stuff
I
like
mean, really, no matter how we look at it, it was a really rough time. We will have future pandemics. We will have future challenges where society and healthcare will look at each other with fear, anxiety. The just the cost of healthcare, the changes that are going in the healthcare system triggers some of those things. But the new technologies, new medications, new treatments, that are in the pipeline that are right here, right now. It's pretty amazing. I mean, we live in an outstanding healthcare period of time. And to be part of that as a patient kind of sucks sometimes, but to be part of that as a patient, knowing that there is now amazing treatment options that weren't there, before, it's good. It gives me excitement, and hopefully, the physicians and providers that are watching this will realize how lucky we are, how amazed we are at what the tools that we have, but also what a great future we have in front of us.
Mm. Yeah, amazing. You have me getting excited, and I'm not even a provider.
Huh, come join us. Come join us.
Absolutely.
Medicine is. Come join us.
Amazing. And then do you have like any tips or advice that you would specifically give to patients? I think people watching might want to know, especially if they have some, attitudes toward healthcare or they've struggled with it in the past. Like, do you have any tips that you would give to them?
I, I'm a patient, so I am type 2 diabetic, and I have um, medical issues that I have to deal with, my back pain, my heartburn, my ball head, there are all these things. And um, I think my advice to it's hard to tell patients that. I mean, that's a super hard question. Um, I'll answer it with my restaurant analogy. So, you know, get the information you need before you see a provider. Don't just go to somebody who is in network or who's closest to your home or your office, and then try to get a feel for this person. Do they look like somebody who you get along with? And I think that doctor-patient relationship is crucial, and before the patients walk in the door, they do have that choice. Fortunately, like as an example, in the San Francisco Greater Bay Area, there are hundreds of physicians similar to me who are ear, nose, and throat doctors. And your family physician may say, go see Winston, but you don't like bald guys from Jamaica, so if you walk in and you see me, you're gonna go, "Oh my God, he's so bald." You may want a different look. So if you don't like bald guys from Jamaica, don't come in the door. But choice is super important, and then also reading up on physicians so you can come in. And then also having some ideas, and this is why I like the internet now, is that you can really have some ideas of what you think's going on. Write down those ideas on a little card. Why am I blocked? Why am I having headaches? Why is there so many postnasal discharge? And then also have very clear don't go zones. I am done with antibiotics. I can't take any more steroids. This is really making me miserable. Just have your don't go zones so that when we interact with you, again, as a restaurant, if you're a vegetarian, you're not going to go to a steakhouse, right? And when you come in to a restaurant like mine, if you're a vegetarian, you need to say, I am done with antibiotics. I don't want any meat. These are my expectations so that it's your body. And I think patients need to just remember that right up front. It's your body, and we need to partner with you. And if a physician provider is not comfortable with a patient saying, "Hey, it's my body," then you probably have the wrong provider. And work in that relationship, quite often you just have to say, "Stop. I don't think you're listening to me. I don't think you're hearing me. I really have taken 12 courses of antibiotics. My gut is trashed. I am not sure I want to take any more antibiotics." Or maybe on the other side of the coin, where a patient has had 5 surgeries already, and they're like, "We're done with surgery. That's just it's traumatic on my body. It may be fun for you to do the surgery, but I have to take off 3 weeks from work. I'm a single mom, and I don't think that's what I want to do right now." So I think patients should continue to be empowered, but also um, just know what they want, and work with their providers to say, okay, this is what you want. This is what we can give you. And then if that delta is not too bad, you've got a good relationship. I mean, if the delta is like right on where this is the patient and this is the provider, that's the sweet spot. And quite often there's some negotiation during the clinical evaluation, during the treatment options, where you can say, okay, let's over the next few visits get to a place where both of us are going to be happy with the outcome.
Right. Yeah, that's so, and it's such a hard thing to do for patients sometimes is to advocate for themselves when they're standing, in the office of their provider, like having those no-go zones. I've never heard of that. I'm going to use that when I go to the doctor next time. That's amazing. And it's really important for patients to understand that they can do that, obviously to kind of understand what the provider is telling them and to take that in, but to also have like the things that they are just absolutely not willing to do and to kind of advocate for themselves. So that's top tier advice for sure. And I will take that into my own personal life as well. And
I
yeah.
mean, it's a relationship, and that's the greatest thing about medicine. It's that, the both people. I mean, we as physicians also have no-go zones where we say, well, that I can't fix.
Mhm.
That's something that I wish I could fix, but I just can't fix it. I'm not a miracle worker. Um, but I'll tell you ways in which we can reduce the symptoms or we can make it, less of a burden to you. But the magic wand and the crystal ball haven't arrived yet from Amazon. And I ordered them, but they haven't gotten here yet. So, when they get here, I can help you with just go magic wand, crystal ball. But between now and then, the technologies that we have and the communication that we have can get us to make you better.
Of course, yeah, it goes both ways, being able to trust your provider and having them know you and know that you're going to advocate for yourself and work together. It's a very, important relationship between patient and provider. And I think you've advocated for that throughout this whole talk, which is amazing. And I think you literally deserve a shout out. So if you would like, tell everyone that is listening where they can find you, where they can learn more about your practice, social media, website, stuff like that, because a lot
Yeah.
of people need to know this.
Oh, first of all, thank you for having this conversation with me. We're not big on social media because I'm actually quite lazy at doing that kind of stuff. I'm more interested in seeing patients. We are California Sinus Centers. It's myself, and two other providers, Dr. Karen Fong, Dr. Peter Kim. We have two amazing nurse practitioners, Karen and Vanessa, and several amazing medical assistants and front desk staff. The easiest way to find us is Cal, sinus, sinus.com, calsinus.com. That's our website. You'll see our offices throughout the greater Bay Area. We are also in the process of expanding our practice, bringing in a nasal surgeon who does the external nose, and will be calnose.com for that. So Cal Sinus, Cal Nose. And we're part of a bigger medical group called the BASS Medical Group in the Greater Bay Area Surgical Specialties. That's who we are. That's where you can find us. I am not on TikTok, not on Instagram, not on Facebook, except for my personal life.
Mhm.
And same thing for my partners, just our websites.
Cool, perfect. Yeah, we'll make sure we get these links, in the descriptions of things so that people have access to this and to you so they can learn more. And this has been so incredible. I've thoroughly enjoyed this conversation and getting to know you and your perspective and your amazing insights. And thank you so much for just taking the time to do this. We really appreciate it.
It's been my honor chatting with you guys on a Friday morning. Have a great holiday season.
Yes, you too. Take care.